Welcome back to Life and Living. I'm Joanna Gagis. I'm at the Virtua Health and Wellness Center in Moorestown, New Jersey. This is a unique space that combines all the aspects of prevention healthcare with the accessibility of urgent care. It's all part of Virtua's mission to help the community be well, get well, and stay well. Bob, what is the mission of the Virtua Health and Wellness Center here at Moorestown?
It's really to be a community health asset and really to be able to provide a wide range of services to the community so they can better manage their health.
What are some of those services?
Well, the services range from services on the front end of healthcare, so really based on prevention and wellness, everything from fitness and spa and primary care to access to the region's top specialist, and also services to help people recover from illness and injury.
What was the thought process behind the building, the actual facility?
The thought process was really to design a facility around the needs of today's healthcare consumer. People are very busy today, and we know how important it is to be able to access services. So we knew they had to be done in a way where it was very convenient and easy for the community, and also to create an environment that's very warm and welcoming so people want to take care of their health.
Ayanna Lott runs the fitness center, which covers the prevention end of the healthcare continuum. Ayanna, give me a brief overview. What's here at the fitness center at Virtua?
We have everything that a person would want to have if they're working out. We have 4 pools in our aquatic department. That includes a 25-meter lap pool. We have an exercise pool for aquatic classes, such as aquatic Zumba, aquatic aerobics, a warm water therapy pool that's for arthritis foundation classes. We also use it for a physical therapy and occupational therapy department. On the fitness floor, we have about 50 cardio machines. We have strength equipment, free weights. We have a sauna and also the steam room. And we have medically integrated programs that they can also go to.
You have medically integrated programs. Tell me what that means.
Medical integration is for people who have sicknesses, traumatic illnesses, such as diabetes, cancer, orthopedic services. Those are things that they just come right out of the hospital, they come to us. We also have a prehab program where people who are about to go into surgery, they're preparing their bodies. So our staff, they all have a degree in exercise science or kinesiology. So they come here and they're working with skilled staff who can help them in their transition and help them to recuperate faster.
How closely do you work with the physicians who are treating these patients?
Well, it's funny you ask that question because this is Virtua. Virtua is a health system. So we have a cardiac rehab department and we work together. We integrate them from the cardiac rehab program and then we say, hey, you're right next door to us, right? You are in the habit of coming already. Just keep coming to work out.
Tara, you do a lot of the health assessments for members who come here. Tell me what that is and why that's important.
Well, with your membership, you get a fitness assessment and a consultation every 3 months. And the fitness assessment is submaximal fitness testing, where we will do different aspects of fitness, cardiovascular, muscular fitness, and flexibility. And then we have a half-hour consultation with them, which is where we will actually use a fitness chart, write down an entire program for them that bases their needs, and it's completely custom for them, and it gives them a good base to start from. And we're also always available to help them with any exercises or setting up machines, whatever they need. Anyone in a red shirt is able to help at any time.
Even if they're in a class?
Even if they're in a class.
You came here to get a health assessment, is that
Yes.
correct? Why is that something that's important?
Well, when you're 77, you need to know how much you can do to improve and keep yourself going as long as possible. I have grandkids and I like being active. So.
What does being active do for you?
Makes me feel alive. Keeps me going. Yeah, makes me happy.
Beyond the fitness center, the Virtua Spa is also an important component of prevention. Mia, why is it important to have a spa at a wellness center?
I believe it's important to have a spa at a wellness center for a few reasons. One, we believe that in order to be well, get well, and stay well, you need to have all those areas available for you. Not only can you work out, see a dietitian, have somebody work with your needs, but we can also give you that balance of coming over to a spa and taking stress away, or somebody who suffers from migraines or anxiety or panic attacks or just needs a calming area to relax and unwind, and we can now offer that with a spa all in one facility.
How does a center that focuses on prevention actually help drive down the cost of healthcare?
Because we know if we could activate the community earlier, we can lower the cost of care. If someone's battling a chronic illness, if we can work with them ahead of time on exercise and diet and all those other things that help a chronic illness, we can avoid a hospital stay, which is the most expensive way to deliver care.
Prevention isn't the only way this facility keeps patients out of the hospital. The Urgent Care Center offers an alternative to visiting the emergency room. So Rebecca, how do you differentiate urgent care from emergency care?
Urgent care is really a step down from emergency care. So what we do here is treat minor illnesses and injuries that come around at an inconvenient time when you can't get in to see your primary care doctor.
Like what?
Something that would be appropriate for an urgent care would be a sprain or strain, or a minor bone break, a sore throat, earache, urinary tract infection, something where you're sick and need to be taken care of, but it's not a true emergency.
If someone is not sure whether they should be at the urgent care center or at the emergency room, what do you do and how do you recommend that they proceed?
So the first thing they should do is call their primary care doctor. And some people don't have a primary care doctor, so then they can call here and ask what really is the right place for them to go. If it's a life-threatening injury where someone is having chest pain or they can't breathe, that's something that you would call 911 and go to the emergency department. I like to think of it like this. An urgent care is really a primary care practice on steroids. We are able to take x-rays, we are able to do sutures, and we're able to diagnose those minor illnesses. But if you have had abdominal pain for maybe 2 weeks, and you're probably going to need a CAT scan or diagnostics that are going to keep you in our department for more than an hour, then that's really an emergency room visit.
My father, who's 74 years old, had a trip and fall at home. They live very close to this area, and my father was a little resistant to the idea of going into an emergency room to get himself checked. He didn't like the feeling of potentially waiting all day for care, didn't feel like the injury was that serious, so they hopped in the car and they drove here, saw the doctor, got the x-rays. Dad did have a broken rib. Talked about treatment and what he could do. They sent the information to his primary care. It was completely comprehensive, and they were walking back out the door to their car in about 90 minutes total.
Why is a place like this so important for the community?
Oh, it's so important for the community right now as there really is a shortage of primary care physicians, and that's a trend across the country. It's not just in this location. So what we are trying to do is provide access, the right care at the right time for the right cost, and really we're hopefully going to be able to alleviate those folks that really need care and can't get it when it's appropriate.
Do you want this to be a place where people are going for primary care?
No, this is not a primary care office. That's a great question. We really want our patients to have a primary care doctor that's managing their chronic disease or that knows them, even if they don't have a chronic disease, that knows them and has a relationship with them. We're here when you can't get to your primary care doctor.
I think the future of healthcare, people are going to have to get more engaged in their care. So the first step is to make sure they have access to care. And if we really want people to be engaged in their own care, we have to make it easy and convenient. And we have to provide an environment that's non-institutional, that's warm, that's welcoming, so you want to engage in your own healthcare.